The topic under discussion today is about the chemical mediators that are responsible to cause chest pain. Remember, we have explained in a very detailed way the angina, its pathophysiology, pharmacology in a very simple and easy way. Well, coming to the point, that is today's discussion, that's about the chemical mediators that are actually responsible to cause chest pain. First, let me tell you the chemical mediators, their name. Actually, we have two chemical mediators. Number one, that is adenosine. Number two is lactic acid. These two are the mediators that are responsible to cause chest pain. Okay? Now let's know how these chemical mediators are responsible, are going to cause chest pain. Simple. We know this point very well, that heart is supplied with the blood vessels known as coronary arteries. Now, what happens in some people, this coronary artery, it gets occluded partially. I'm not talking about the complete occlusion because that is going to have to provide us another situation. Forget about complete occlusion, simple. When there is a kind of occlusion, means narrowing of the diameter of these coronary arteries, what will happen then? Then the blood flow to the myocardium will decrease. Now, this decreased blood flow to the myocardium will cause decrease in supply of oxygen to the myocardium. Now, in this condition, when there is insufficient oxygen for the myocardium, this myocardial cell will break the ATP, and at the end, what will be synthesized? Adenosine. We know this point very well. ATP is composed of adenosine and 3-phosphates. Now, this adenosine, which is being broken now by this myocyte, which is under stress because it is not having enough supply of oxygen. Now, then this will release the adenosine. Now, this released adenosine, and in the meanwhile, the heart will switch to glucose metabolism. Before, when there was enough supply of oxygen, the heart was not going to switch this way. Then we were using the fatty acid. The heart was using fatty acid. Now, because of decreased supply of oxygen, the heart will start consuming the glucose in order to fulfill the energy. Now, this glucose metabolism will be anaerobically, okay, anaerobic. Now, this anaerobic glucose metabolism will synthesize pyruvate. Then these pyruvate will be converted into lactic acid. Why? Because this is anaerobic respiration. Now, this lactic acid at the end plus adenosine, these two are responsible to stimulate receptors known as A1 receptors. When these receptors are stimulated, these are actually named as pain receptors, okay? Now, when these are stimulated, the case is obvious. When the pain receptor is stimulated, then the pain will be sensed. So at the end of the day, we'll receive pain. So these two are the chemical mediators synthesized, then they're going to act on the pain receptors, and at the end, they are resulting into a pain sensation, painful sensation. So this is how the pain is actually sensed